Top 4 vitamins every fatty liver patient must take. Proven results. Struggling with constant fatigue and discomfort from fatty liver disease? Or worried about your condition progressing to something more serious? Good news! The right vitamins can help reduce liver inflammation, support liver regeneration, and even reverse fat accumulation in your liver. Today, we're revealing the top 4 essential vitamins that help fatty liver patients reduce liver fat, improve liver function tests, and potentially reverse their condition. So stick around because you don't want to miss these life-changing nutrition tips. Vitamin E stands out as a powerhouse antioxidant that specifically targets the inflammation and oxidative stress in fatty liver disease. But how exactly does vitamin E help with fatty liver disease? Let us engage in exploration together. Oxidative stress is a leading cause of liver cell damage in fatty liver disease, and antioxidants are essential for neutralizing harmful free radicals. Patients with NAFLD, non-alcoholic fatty liver disease, often show increased markers of oxidative stress, which worsens liver inflammation and fat accumulation. Vitamin E is a potent fat-soluble antioxidant that directly targets these free radicals. A daily dose of 800 IU of vitamin E has been shown in clinical trials to reduce liver inflammation, decrease fat deposits, and improve liver enzyme levels. Including vitamin E in your daily regimen supports liver cell protection and repair, lowering the likelihood of disease progression. How does vitamin E's anti-inflammatory action specifically support liver healing in fatty liver patients? Inflammation is a critical factor in the progression of fatty liver disease to more serious conditions like NASH, non-alcoholic steatohepatitis, and cirrhosis. Without proper anti-inflammatory support, chronic liver inflammation can lead to permanent scarring and loss of function. Research shows that fatty liver patients have higher levels of inflammatory cytokines that drive disease progression. Vitamin E helps inhibit these inflammatory pathways, reducing both acute and chronic liver inflammation. Studies published in the New England Journal of Medicine demonstrated that high-dose vitamin E supplementation significantly reduced liver inflammation markers and improved histological features of NASH. By taking vitamin E regularly, fatty liver patients can help reduce the inflammatory cascade that damages liver cells and worsens their condition. Vitamin E also plays a direct role in improving liver enzyme levels. When liver cells are damaged, they release enzymes like ALT and AST into the bloodstream. High levels of these enzymes indicate active liver damage and are common in fatty liver patients. Studies show that vitamin E supplementation can reduce ALT and AST levels by 30–40% within 6 months of consistent use. This improvement in liver enzyme levels correlates with reduced liver inflammation and fat content visible on imaging studies. Regular vitamin E intake helps protect liver cell membranes, prevent cellular damage, and support normal enzyme function, leading to improved liver health markers. Are fatty liver patients more prone to vitamin E deficiency, and how does this affect their condition? Yes, patients with fatty liver disease often have lower vitamin E levels due to impaired fat metabolism and absorption, increased usage of antioxidants to combat oxidative stress, and dietary patterns that may be low in vitamin E-rich foods. Vitamin E deficiency can worsen fatty liver disease by leaving liver cells vulnerable to oxidative damage, accelerating fat accumulation, and reducing the liver's natural detoxification capacity. Vitamin E supplementation is particularly beneficial for fatty liver patients because it directly addresses this deficiency, provides targeted antioxidant protection to liver cells, and works synergistically with the liver's own detoxification systems. While green leafy vegetables, nuts, and plant oils are excellent sources of vitamin E, supplementation is often needed to reach therapeutic levels for fatty liver disease. Certain patients should adjust their vitamin E intake based on health conditions. Those on blood thinners should consult their doctor due to potential increased bleeding risk. Patients with cardiovascular disease should discuss appropriate dosing with their healthcare provider. Those with diabetes should monitor blood glucose levels when starting vitamin E supplementation. For most fatty liver patients without these conditions, vitamin E is a highly beneficial supplement that supports liver function, reduces inflammation, and helps reverse fat accumulation. To maximize benefits, fatty liver patients should take vitamin E with a meal containing some healthy fats for better absorption, and combine vitamin E with other liver supportant nutrients we'll discuss next. For patients looking to reverse fatty liver naturally, vitamin E is one of the most research-backed supplements available. So next time you review your supplement regimen, consider adding vitamin E to support your liver health journey. 2. Vitamin D. Vitamin D is much more than just the sunshine vitamin. It's a crucial hormone that plays a direct role in liver health and metabolism. When vitamin D levels drop too low, fatty liver disease risk increases significantly. Vitamin D deficiency is incredibly common among fatty liver patients, with studies showing 70% to 90% have insufficient levels. One study found that adequate vitamin D levels, above 30 mg/ml, were associated with a 54% reduction in fatty liver disease risk. By maintaining proper vitamin D levels, patients can help regulate liver metabolism, reduce inflammation, and improve insulin sensitivity, all critical factors in reversing fatty liver. What happens when vitamin D levels are too low, and how does it contribute to fatty liver progression? Vitamin D helps regulate glucose and fat metabolism in the liver. When levels drop, insulin resistance increases, causing more fat storage in liver cells. Low vitamin D disrupts the balance of inflammatory cytokines, creating a pro-inflammatory environment that damages liver tissue. Cellular stress response systems become impaired, making liver cells more vulnerable to damage and death. Studies show that fatty liver patients have significantly lower vitamin D levels than healthy individuals, with a direct correlation between the severity of deficiency and disease progression. By restoring vitamin D levels through supplementation, patients can help normalize liver metabolism and reduce fat accumulation. Insulin resistance is a core driver of fatty liver disease, and vitamin D plays a crucial role in improving insulin sensitivity. Vitamin D receptors are found throughout the body, including on pancreatic beta cells that produce insulin and on liver and muscle cells that respond to insulin. Research shows that vitamin D helps improve insulin receptor function, enhance glucose uptake from the bloodstream, and regulate hepatic glucose production. Each of these mechanisms helps reduce insulin resistance, which directly impacts liver fat accumulation. For fatty liver patients, especially those with prediabetes or diabetes, maintaining optimal vitamin D levels is essential for managing not just liver health, but overall metabolic function. Nocturnal liver pain and discomfort are often reported by fatty liver patients due to inflammation and organ distension. Since vitamin D has powerful anti-inflammatory properties, supplementation may help reduce these uncomfortable symptoms. Vitamin D acts by inhibiting inflammatory pathways in liver cells, promoting balanced immune responses rather than chronic inflammation, and supporting liver tissue repair processes during rest periods. For patients experiencing liver discomfort, combining vitamin D supplementation with other anti-inflammatory approaches can help provide relief while addressing the underlying disease process. Vitamin D supplementation helps restore healthy vitamin D levels, improving insulin sensitivity and metabolic function. It reduces inflammatory cytokines that drive liver inflammation and damage 3. While antioxidants like vitamin E and hormones like vitamin D are well known for liver support, B vitamins are another powerful addition that can significantly improve liver function and metabolism in fatty liver patients. Packed with methylation support, homocysteine-lowering effects, and energy-boosting properties, B vitamins, particularly B12 and folate, support detoxification pathways and liver regeneration capabilities. Methylation is a crucial biochemical process that supports liver detoxification and fat metabolism. B vitamins are essential cofactors for these methylation reactions. Many fatty liver patients have impaired methylation due to genetic factors or nutrient deficiencies, which worsens their condition. They support the liver's phase 1 and phase 2 detoxification pathways, reducing toxic burden on liver cells. Studies show that fatty liver patients with B vitamin deficiencies experience more rapid disease progression and higher liver enzyme levels. By supplementing with B-complex vitamins, particularly B12 and folate, patients can support liver cell integrity and help normalize enzyme levels. While all B vitamins contribute to liver health, some are particularly beneficial for fatty liver patients. Vitamin B12, methylcobalamin, essential for fatty acid metabolism and cellular energy production. Folate, supports methylation and homocysteine metabolism. Vitamin B6, activates over 100 enzymatic reactions in liver metabolism. Choline, often considered with B vitamins and reduced liver fat accumulation. For the best results, fatty liver patients should consider a comprehensive B complex that includes these key nutrients in their active forms. Vitamins are water-soluble, so excessive amounts are generally excreted rather than stored. Patients with severe liver disease should start with lower doses and increase gradually. Solution: choose a high-quality B complex with active forms of folate and B12 to ensure proper absorption and utilization regardless of genetic factors. For fatty liver patients looking to naturally improve their condition, incorporating a comprehensive B complex with special attention to B12, folate, and choline can significantly support liver health and function while addressing common deficiencies in this patient population. But for vitamin C. Vitamin C, while often associated with immune function, plays a critical role in liver health through multiple mechanisms that directly benefit fatty liver patients. As a powerful antioxidant, vitamin C helps combat the oxidative stress that drives liver damage in NAFLD. When liver cells are overwhelmed by free radicals, vitamin C steps in as a first-line defense. One study found that fatty liver patients have significantly lower vitamin C levels than healthy individuals, with levels inversely correlated with disease severity. A medium orange provides about 70 milligrams of vitamin C, but therapeutic doses for liver support often range from 500 mg daily. By maintaining adequate vitamin C levels, fatty liver patients can help reduce oxidative liver damage, support collagen production for tissue repair, and improve their overall antioxidant status. What happens when vitamin C levels are too low, and how does it contribute to fatty liver progression? Vitamin C is essential for neutralizing free radicals that cause liver cell damage. Without sufficient vitamin C, oxidative stress increases dramatically, accelerating liver cell injury. Vitamin C supports glutathione production, the body's master antioxidant that is often depleted in fatty liver disease. Low levels impair collagen synthesis, weakening liver structure and impairing repair processes. Studies show that fatty liver patients are at higher risk for vitamin C deficiency due to increased antioxidant demands, dietary patterns low in fresh fruits and vegetables, and metabolic disturbances that affect nutrient utilization. By supplementing with vitamin C, patients can help restore their antioxidant defenses and support normal liver structure and function. While many focus on vitamin C's immune benefits, its role in collagen synthesis is particularly important for liver health. Collagen provides structural support for liver tissue and is essential for repair processes. In fatty liver disease, especially as it progresses, fibrotic changes alter liver architecture. Vitamin C ensures that collagen formation occurs normally, supporting healthy liver structure without excessive fibrosis. Each healthy liver cell requires proper structural support, which depends on vitamin C-supported collagen. For fatty liver patients, especially those with advancing disease, maintaining optimal vitamin C status helps ensure that repair processes proceed normally, without tipping toward pathological fibrosis. Vitamin C also helps regulate inflammation within the liver tissue. Chronic, uncontrolled inflammation drives disease progression in fatty liver disease. Vitamin C helps modulate NF-κB pathways that control inflammatory responses, reduces pro-inflammatory cytokine production that damages liver cells, and supports balanced immune function rather than chronic inflammation. Studies have shown that vitamin C levels are inversely related to inflammatory markers in NAFLD patients. For those dealing with fatty liver disease, maintaining optimal vitamin C levels helps to control the inflammatory processes that can accelerate disease progression. While all antioxidants provide benefits, vitamin C offers specific advantages for fatty liver patients: water-soluble and quickly available to tissues undergoing oxidative stress. Regenerates other antioxidants like vitamin E, extending their protective effects. Directly supports glutathione production, which is often depleted in fatty liver. Provides immune support, reducing the risk of infections that could further stress the liver. Helps improve iron metabolism, which is often disturbed in advanced liver disease. For fatty liver patients, vitamin C can be a cost-effective addition to their supplement regimen with multiple benefits. How much vitamin C should fatty liver patients take daily? The ideal intake varies based on disease severity, oxidative stress levels, and individual factors, but generally, 500 mg daily, divided into 2-3 doses for better absorption and utilization. Patients with more advanced disease may benefit from the higher end of this range. For fatty liver patients looking to comprehensively support their liver health, vitamin C represents an affordable, well-researched addition to their daily regimen that addresses multiple aspects of the disease process. If you found this video helpful, please remember to hit the like button. It really helps us bring you more valuable content on NAFLD health and NAFLD management. Drop a comment below and let us know your thoughts, questions, or what liver health topic you'd like us to cover next. We love hearing from your experiences with these supplements. Of course, hit the subscribe button and turn on notifications so you can never miss out on our latest health tips and insights for managing fatty liver disease. Stay informed, stay healthy, and we'll see you in the next video.